Healthcare personnel are assaulting patients for money. We've seen three major news stories exposing widespread assault on patients and people of all kinds by healthcare personnel in just the last few months, y'all. Hey everybody, I'm Marlon with Chronic Pain Warriors United. Let's jump right into it. So in May, pain clinic owner, CEO, and human piece of excrement, Michael Kestner, this guy, is in the news for being sentenced after he was convicted of running a $35 million Medicare scheme on patients and the government in North Carolina, Virginia, and Tennessee. The scheme was, or the fraud was, they were forcing patients into dangerous and unnecessary procedures, i.e. epidurals, that the vast majority of them didn't want and that wouldn't do them any good even if they did want it. The injections were like placebo. They had no actual benefit. That is assault, my friends. That is assault, plain and simple. And how many of y'all have had your pain doctor say, I think you need these procedures or shots. And if you don't want them, maybe we don't do your pain medications next month. My grandmother dealt with that. The system out in California was shut down because of this. Thousands and thousands of pain patients losing access because of that and their actions. And then this one, they did this over 700,000 times. And by the way, they were billing Medicare at 8 times the rate of the next closest clinic, company, paying doctor in general, whatever. Absolutely insane. Then July, the Department of Health and Human Services releases data on organ donors being assaulted by organ procurement teams. They are trying to take people's organs not only when they are not dead, but when they are actually improving in health. And that is also the definition of assault, in my opinion. And by the way, none of the people in the media call any of these things what they are. That is assault. What Mr. Kestner was doing was assault. And by the way, it gets worse. They were also speeding the deaths of patients so that they could procure their organs. That is murder. It's not speeding the death. It's not helping them on their way. It's none of that. It is murder, plain and simple. And yet, no one in the media actually addresses this or calls it what it is. The New York Times, by the way, this is not new. The New York Times was, I think, looks to be the first major news organization to report on this problem way back at 2008. And what was the reaction to them at the time? Politicians and medical leaders said it was either untrue or exaggerated. Yeah, about that. And by the way, this data that HHS has released, I guarantee is just skimming the surface. If they go underwater and look at the rest of the iceberg, my God, who knows what you'll find. And then last November, the Lowen Institute published this study, which we've talked about a few times, showing that there were 200,000 unnecessary back surgeries performed over a 3-year period of time on Medicare patients alone. It also cost Medicare $2 billion. Now, the financial cost is bad enough, no doubt. What about the human cost? What about the damage that was done to these people who did not need these surgeries? And what about the doctors who did them? I don't see anybody in the government talking about going back, finding all the doctors who did all these unnecessary surgeries and charging them with assault, because that's what it is. It was assault. They told a patient that they needed something they didn't in order for them to feed either their own addiction to surgery, money, power, or all three usually. The fact that this all is just sitting out there and none of this is like super new. The pain clinic owner thing, That's been going on since last year. The only reason it's back in the news now is because he was sentenced. By the way, I forgot to tell you, how long do you think he got? 18 months. He was sentenced to 18 months in prison while the prosecution was asking for 20 years. Yeah, he's 73 years old. It'd have been a life sentence. I don't care. He deserved it. My God. Anyways, I asked AI to look into, try and extrapolate these 200,000 numbers from the Lowen Institute to the entire country adult population. You come up with somewhere between 400,000 and 600,000 unnecessary back surgeries performed on pain patients like us seeking pain relief from back problems and back pain. My God, how much harm have they really done to all these people? I would love to go back and be able to find some of these people who these unnecessary assaults were done on and ask them how they feel. I mean, I know Carrie, she comments pretty consistently. She was one of the individuals that isn't necessarily covered by this, but was pushed into an unnecessary surgery by her doctors because she trusted them. And come to find out years later, she didn't need it, and it cost her a lot. It mangled a big part of her life and abilities to enjoy that life. So why are these things happening? The pain clinic situation first, because they thought they could get away with it, because they have all the power, because pain patients are afraid to confront their doctors, pain clinics, and to fight back, because it is so easy for them to write you off, destroy your quality of life by removing your life-saving pain medications. And yes, they are life-saving, and making it extremely difficult for us to get into another doctor or having another doctor be willing to treat us. We know all of this. And because of it, most pain patients will take almost anything as long as it doesn't impact their ability to get their pain medicines too badly or impact them in the long run of getting those things that they need. But at some point, it's got to come down to, how can we keep allowing this to happen? Reform is absolutely, positively more needed than ever. And that's what we're here for. That's why we created Chronic Pain Warriors United. Pushing these stories into the mainstream is another part of why we created CPWU. You know how many news agencies talked about the pain clinic story? Very, very few, after the man was sentenced, by the way. And then in July, when Department of HHS started revealing all these complications with the organ donor system, the media did report it, but grudgingly. And then they wanted to blame RFK for bringing it to light. It's one of the better things the man has done. People complain about, well, why didn't we know more? Why didn't he do it sooner? Blah, blah, blah. We wouldn't have known anything if it wasn't for that man's action. So I applaud him in that regard. Who knows how long they would have buried that data if he wasn't there? So, and then the Lowen Institute. I'm going to leave it at that and we'll be finished. If there were really 400 to 600,000 unnecessary back surgeries performed on patients by these doctors over that period of time, and I have no problem believing that there were, that is criminality and assault on a level that is so immoral and so evil that it's actually kind of hard for me to comprehend. I can't wrap my head around how people who supposedly took an oath to do no harm can do these things over and over and over. Because it's not like they're just doing it once to one patient. It can't be. And all the complications that people like Carrie would have wound up with because of these surgeries. Any of y'all out there that have dealt with this, please let us know in the comments. Any of them, all three of these things. If you've known anybody who organ procurement teams did badly, I'd love to hear about that. Let us know. Anything to do with the pain clinic system, all these unnecessary surgeries, all these people who are being subjected to torture by this system is just so infuriating and wrong. Anyways, your stories, just like y'all, are unique and important to the pain management reform movement. So please leave them in the comments when you can. People seeing those stories and then feeling like they can post their own, feeling like other people are living a shared life experience, and showing able-bodied, healthy people what is happening to their fellow Americans and compatriots all over the country is super important. That's why I always ask y'all to post your stories below, because I read them and so do many, many other people. I guarantee you, I've had a lot of emails about that. So please leave your stories when you can. We are going to stop this, y'all. We are. It may seem futile. It may seem like we can't do it. I swear to God, it's not true. We can do it and it will be done. So that's it. Hope y'all have a great rest of the week, and we'll be with y'all Thursday, Friday, and Saturday soon. See y'all soon. Marlon out.